You're listening to your local station, 88.6 Plenty Valley FM. And on the program with me today, lead practitioner, family practitioner, mental health and wellbeing hubs of Victoria Northern Region, Mind Australia, Angela Gullone. Good morning. That's such a big title.
It is, isn't it? Good morning, Denise.
Must be hard to sort of introduce yourself to a lot of people. But
Yeah.
you're here today to talk to us about some mental health and wellbeing hubs. Now, until just recently, I hadn't heard of them, and I thought it would be a good one to get you on the program and to talk all about where they are and what services they provide. So, first of all, I know they're in the local area, but specifically, where can we find these mental health and wellbeing hubs?
Oh, yeah. So the hubs are situated at co-locations within health and community services. So, for example, you'll find some at health clinics and neighbourhood houses across Melbourne as well as Victoria regional areas. They are basically consultation spaces where you can meet a mental health professional to discuss your mental health and wellbeing concerns. The hubs are also spaces where psychoeducation and wellbeing course groups will be run from. A second point I want to add is about the hubs is that they're more than just a physical space, Denise. The hubs offer telehealth services via phone and video link as well. So that's a great benefit to people who may struggle with hesitation to leave home or struggle with time, transport or other challenges, because we are finding more and more that clients are preferring a combination of both.
You've got a couple of new hubs which are actually in Craigieburn and the Hume area.
At the moment, Mind are running the hubs from Greensborough, Abbotsford, Footscray, Coburg. Our Craigieburn site and Coburg site will be coming soon. In the Plenty Valley region, we have Greensborough. We're running out of Headspace, and Headspace is located on the main street in Greensborough. I can share the details with you, and you can post them on your site for your clients to come to.
That'd be great.
So, and then in Abbotsford, again, that's in Collingwood. We're at Headspace again, and that's a youth and family welfare organisation. Once again, that's in Lulu and Abbott Streets at the Victoria Park Social Club building. The drop-in times vary, so it's a good idea to perhaps ring ahead if you're looking to drop in. In Greensborough, the drop-in times are 10 to 3 on a Tuesday. In Abbotsford, 10 to 3 again on a Wednesday. At Coburg, in our Newlands neighbourhood house, we're looking to have a drop-in on a Friday. And in Craigieburn, it's early days, so I think that might be a Tuesday as well.
All 10 to 3?
Yeah, mostly 10 to 3. Yeah, they're the hours.
What services are they providing exactly?
The kind of services that we are doing at the moment with clients is we help develop a plan and a strategy for people that are needing help with their mental health and wellbeing. So there is a range of needs that are coming through, such as life stresses, such as schooling, work, finances, changes in life, such as children moving away or changes in relationship status. We help people rebuild confidence. We also improve social connectedness and emotional well-being, and also practical matters as well are coming through, so food aid and financial aid and support there.
What would be the key one that you've found has been people coming to you more about?
That's a good question. I think the Victorian government has funded the mental health and wellbeing hubs because the service has been set up to respond to increased mental health and wellbeing needs that have actually stemmed from fear about the pandemic and multiple lockdowns. So what we're finding is people have been displaced at work, they're experiencing financial difficulties, people have lost confidence, they've lost that structure, that social connectedness they used to have, and there have been shifts in relationships as well. So a lot of kind of relationship statuses have changed too. So they're kind of things that are showing up.
What advice would you give somebody who sort of feels that way, but they think, I'm the sort of person who needs to just go to a hub, but, you know, they're sort of a bit in denial maybe, or really if I go there, I'm probably wasting their time. And, you know, what would you say to somebody who was thinking that?
I would say just reach out. You know, it's a free service. Unlike other services, you don't need a referral. Look, if you're having a difficult time or you're feeling overwhelmed, just call the 1300 number. So it's a 1300 375 330 number. Yep. You know, and you can speak with a local mental health and wellbeing hub in your area. It doesn't have to be an ongoing service that you access. You might just want a one-off consultation. You might just want to drop in and just get some advice. You want maybe someone to hear what's going on, and maybe that will be enough, or someone can help point you in the right direction, raise your awareness about services around you that might be more specialised, that may be able to assist you with your particular issue.
Is it a walk-in thing, or should you really make an appointment?
You can drop in, you can make an appointment, or you can telephone, and we can offer telehealth. Any of those. It's open to all people who need mental health and wellbeing support in Victoria.
Can you give us some examples of some success stories that you've had? Of course, no names, but some general things that have happened, and there's been a great success out of it.
We've worked with a lot of clients and we've had a lot of success stories. So I'll probably just draw maybe on my own experience, Denise. I was supporting a single parent reached out to us. She's not a typical user of mental health services. She's a carer. She has 2 twin children, one with a learning disability, as well as living with and caring for her elderly father. So due to the multiple lockdowns, any routine around the care and education had been disrupted, and the family, they'd lost their motivation, they'd lost their structure. And this woman, she contacted us in a state of despair that stemmed from the responsibility of, year after year, heavy caring responsibilities to her daughter, her father, alongside the challenges of being a sole parent and a working parent. She came to us, with feeling anxiety and fear about her children's future. So myself, I met with the client on a weekly basis and helped them to develop a plan around identifying and prioritising the stresses that were aggravating her well-being, as well as her family's well-being from her perspective, trying to understand what was going on. And the range of stresses were identified. So they included financial fears about her family's future, fear and guilt about who's going to take on the caring responsibility of her disabled daughter, especially if the child were to survive her. She didn't want the burden to be passed on to the other sibling, but she couldn't see any other way forward. She's also dealing with grief and sadness of having lost a mother and a brother recently, who are key individuals that helped support her raise her family. Her other daughter that was doing well at school had lost motivation and interest in school, so she was beginning to worry about her future as well. Basically, the fatigue from ongoing caring responsibility and feelings of guilt and just not coping. Also, she was very confused about the NDIS and she lacked confidence in advocating for her disabled daughter's needs. There were a lot of conflicting needs that were going unmet and needs that she wasn't really recognising within herself. So we helped kind of prioritise them. So the client was supported to address each of the stresses in turn. And I supported her to connect with financial specialists to help her prepare an enduring power of attorney and a guardianship order. The client says that this in itself has lifted an enormous amount of stress and anxiety from her experience. We discussed options for her daughter in terms of supported independent living opportunities. The client wasn't aware of these opportunities. And so now she has an NDIS plan in place for her disabled daughter that's built around building capacity for her to build up self-care and home care skills so that one day she'll be able to live independently. So now the future looks really different for the client.
Those services that you've just spoken about, they're quite broad-ranging, and website is mindaustralia.org.au. It's a great resource for a lot of things. Now, you've got some services that are referred to on your website, and the closest to Plenty Valley FM in our broadcast area are Ivanhoe, Nillumbik, Dearborn and Whittlesea. If they're going on to the website, can they actually contact those services directly?
To access the Mental Health and Wellbeing Hub, they'll need to contact the 1300 number. These other services that you're referring to refer to psychosocial services that are run by Mind Australia.
Yes.
And certainly we could refer clients to those services if that fits in with their needs.
Okay.
But the best place to access the hubs, if you're having a difficult time or you're feeling overwhelmed, is to call the 1300 number. to get support from the local mental health, your referral will be forwarded to the team closest to you.
First port of call is to call that 1300 number. Can you give us that referral number again?
Yes, certainly. So it's 1300 375 330. Or you can go online for more information as well. You can visit the coronavirus.vic.gov.au/mental health hub site.
You've spoken about a lot of things, what the hubs are doing and where they're located and how everybody can approach them who feels they would like to talk to somebody about their concerns. And that success story was just fabulous, because, I mean, two children and a father to care for as well. There's so many difficulties. What we're saying is don't be shy. Put your best step forward and call that number, and then they can refer you to the appropriate means. Well, thank you, Angela, very much for talking to us on the program. Is there anything else you wanted to say before we wrap?
No, I guess I just wanted to kind of reassure your listeners that our mental health practitioners are qualified and experienced professionals, and that anything they share with us will be kept private and confidential. So, at the time that they reach out, we will ask them some questions like their name, their contact details, and some information about, why they're reaching out. That information helps us to deliver, the best possible service that we can. And we can assure all your listeners that the information we keep it in the strictest confidence, to keep private and confidential.
Thank you very much for being on the program.
Thank you. Thanks, Denise.
We've just been speaking to lead practitioner, family practitioner, Angela Gullone from the Northern Region of Mind Australia Mental Health and Wellbeing Hubs of Victoria.